Dear learners, in this lecture we will know about changing risk factors in India, and myself Dr. Netarand Sahu, Department of Geography, Delhi School of Economics. And here in this lecture the outline of the study basically it will deal with like the introductions, then you will have some like demographic shifts, then we will have to discuss about the environmental changes, then after that we will discuss the technological advancements, we have to deal with like health system challenges, impact on globalization, impact of changing risk factors in India, then organizations involved, case studies and concluding remarks. These are the outlines, and we will also provide some references to the viewers. Then the learning outcomes, the learners will know by the end of this presentation that recognize changes in demographics. Then how this after recognition of demographic changes, then determine the health systems difficulties. Then also learners will know like recognize social and cultural factors, understand the effects of globalization, and then learners will know like analyze the risk factors in India. Also learners will get to know the organizations involved and dynamic of demography. Let us start the introduction. Like significant changes in Indian population structure such as aging and increased urbanization have like very serious effect on social and health services. So within that if you will see like how this like demographic changes, for example another factor is environmental challenges like the loss of biodiversity and rising pollution levels and changing climate are aggravating the pre-existing disease and also posing new health hazards. And we have also like lifestyle transformations, and because of lifestyle transformations also they have serious concern about the disease. Then also we have non-communicable disease like diabetes and heart disease are on the rise as a result of changes in modern lifestyle systems. And within that you can say like including sedentary behavior and food choices. Now the people's food choices changed. Then also socio-economic influence, like important factors influencing the health outcome in diverse demographic groups. How it behaves within different age groups includes difference in the access of health care and also educational attainment and economic inequalities. And again we have to deal with like globalization and technology with growing worldwide connections and technological breakthroughs impacting the health risk at healthcare delivery, and also interconnected world presents like both possibility and difficulties because of this. So let us come to the point of demographic shifts. How the demographic shifts, like we have the population aging problem, like senior citizens, they have some different types of disease they are facing. Then we have increased health demand because of that, and once the health demand is there you have to provide the service to the all the people involved within the demographic change. Now we have more young people in India, so that is also how this shift will have impact on the healthcare. So then urbanization trend also important equally, and also we have like healthcare infrastructures, how the healthcare infrastructure will be provided at the different more million plus cities we have now in India. So urbanization center at the rural level, at the remote area, hilly area, so we have that also very important. Then we have migration pattern of migration within like from one place to another, then interstate, interdistrict, they have rural to urban migrations, and also that impact on the rural health infrastructures. Then healthcare resource allocations, like how the resource has been allocated in different spheres of the healthcare systems, from starting from the village to the urban. Then shifting needs, like how this shifting needs, for example policy adaptations, different types of policy we have at the rural level and we have different types of policy at the urban level. Then we have also social and economic support systems, how whole the people will have to be supported through economic base, like we have nutrition systems, we have for the schooling, we have midday meal, for the PDS system, public distributed targeted distributed public service systems. So that is also very essential. Then changing family structures, we have now India family structure is moving towards from joint to nuclear family, that also has serious impact. So then we have also labor dynamics, like labor markets, more skilled workers and maybe unskilled, skilled, that also factors. Then environmental challenges like pollution problem. Pollution may be air pollution, water pollution, and pollution, we have contaminated water, soil pollutions. Because of that we have reducing the productivity. So air pollution, cardiovascular and various respiratory disease. Then we have climate change and health impact also, like how this climate change and impact the health, like we have vector and various type of waterborne disease because of changing climate, increasing temperature, we have dengue, malaria, that is there. And also extreme weather events, vector-borne disease like dengue, malaria, and loss of biodiversity also has implication on the different types of disease. Like because of certain loss of biodiversity, there are certain type of pathogens are also coming, and that contact to the through air, through droplets to other peoples. So then ecosystem services we have, and also we have emergence of disease, different types of disease emerging and re-emerging again and again also. So that also you have already there is one lecture on that also, like psychological and social well-being of people, how for example during pandemic many people are psychologically depressed, and what they will do, and sometimes they are detached because of that type of pandemic, they are not well connected with their relatives, their families. So that is also problem. Then behavior factors also very important. That all these factors, within that also we have like sedentary lifestyle, for example, it is a factor also, like water pollution and dietary changes, like because of water pollution and waterborne disease, we have like different types of typhoids and all these are coming. So again climate change and physical health, climate like heat waves we have nowadays, so it's a very serious problems. So loss of green spaces and mental health is also another factor that has very serious component on how it is influencing the urban area. This loss of green space also creating like psychological problems. Then socio-economic factors we have like income inequality and health disparities. Income level, rich is richer and poor is poorer, and still we do not have a very healthy style of income systems, and per capita income is very low also, that has serious impact. And then we have employment and occupational health, like during different types of occupation, stress, strain, hypertensions in workplace, that is also another factor that has contributed to this type of like risk factors. Then urbanization and infrastructure strain, education and health and literacy, these factors are all accumulating to have some risk analysis. Then as we have already discussed also, like migration and social displacement, because of migration, people migrating from one place to another place, that has also increased the risk factor. And we have also some type of like climate refugees and climate related migrations. We have also disease migration, because of some disease some people are moving from one place to another place and that carrying that pathogens within them. Then to strengthen the health infrastructure, nutrition and food security is also very important. Okay. Then we have employment and occupational health, so which we have already discussed. And then urbanization and living conditions in the urban area, how people are living, and whether the drinking water, whatever they are drinking is pure, and how whether the health infrastructure is reachable to them, and that is also like immunization systems are going to them. And it is sometimes if disease is spreading on the urban area, because density is very high, that also impact very seriously. So then nutrition and food security, whatever nutritions, whatever you are eating, sometimes maybe in a rural area food are more not that toxic, but in urban area sometimes because of very no poor quality of sanitations and other accessibility problems, we are facing also very difficulties, and sometimes people are using various types of very contaminated water to drink. Then access to technology, what type of technological advancement to have informations, and also what type of information you are getting because of technological advancement, and also access to healthcare, like in the rural area to urban area, if your access to healthcare is very, very important, because that is also, and if during the rise of infection like infectious disease like communicable and infectious disease, if this type of technological informations are very, very also helpful. Then for example, here we can say like what are the COVID-19. During COVID-19, what type of technological advancement and how this spread or this type of spreads across the India and also globe, that has serious impact to our the risk factors. And the tuberculosis, which already sometimes it was like though it is curable when it will be detected, but still it is a also risk factors for like in India, different states we have the cases of death because of tuberculosis, and also dengue fever. Like dengue, it's now it is a almost in every urban area in India, the dengue problem is there. Starting from South India to North India, to Delhi to Kerala, Karnataka, every places we have problem of dengue. Then impact of global travel and trade, like within that is also another factor. And we have, for example, non-communicable diseases, and within the non-communicable diseases like rise of chronic disease, okay, and within the chronic disease like diabetes due to the lifestyle changes. Almost nowadays even children are suffering because of diabetes, and that is maybe you can say it is a lifestyle change, because of lifestyle change that impact this diabetes. So which includes the unhealthy diets and the sedentary behavior and increased consumption of processed food in one of the significant risk factors. Okay, most of the packaged foods you are eating, and like saturated fatty fats you are taking because of that packaged foods. So then hypertension occurs due to stress and unhealthy diets and lack of physical activities, contributing to the also like growing prevalence of like hypertensions. The urban lifestyle and high salt intake are also the key factors. For example, in the packets you are eating the potato chips, that is increasing the also salt content there. Though so you should avoid also like the packet foods. Then cancer prevalence, we have breast cancer causes have increased due to the lifestyle changes like late pregnancies and reduced breastfeeding. Like the office going people, women, they are having no time to feed their baby. So that time the reduced breastfeeding also increase the breast cancers. So lung cancers instance are also on the rise due to rising air pollutions and higher smoking rates and industrial emissions, and also vehicle exhausts that also cause serious types of disease we have in like asthma, cardiovascular, respiratory disease. Then mental health disorders like depressions. For example, depression is a very serious disease also people are suffering. Then anxiety disorder, sometimes very curiosity, and that increases your blood pressure level also. And then improved disease surveillance and monitoring is also a need to control of all this disease. Then enhanced healthcare delivery, like if healthcare delivery systems will be increase, then it will from rural to urban area you can address on different age groups, and also and like advance within that you can see also one factor which is very, very important, like advanced water and air purification technology. And if you are suffering from any water pollution, so without using like nowadays urban area you can see without RO, using of river oxidation process, you cannot drink that water. So then also we have sustainable agriculture and food security, how you can have more nutritional food that will help you so to have healthy lifestyle. Then renewable energy and pollution reduction, healthcare systems challenges, we have also serious concerns about that. Then we have also increased disease burdens, like because of some diseases are increasing, so we have to that stress and emerging and re-emerging diseases, like we have many diseases are emerging again and again, malaria, tuberculosis, something that cases are going on. So chronic disease like asthma, cardiovascular disease and cancers and further overwhelming healthcare services are also very, very taken, we need to take care of it. Otherwise infrastructure like resource allocations, for example, if we have to know adequate resource, then it is very difficult to monitoring all these type of disease, like inadequate facilities. For example, within resource allocations we have very inadequate facilities, and some areas even do not have a healthcare proper systems exist. So then resource scarcity, for example, instrument which is used to like measure your different types of disease parameters, if it is not available, then it is also problematic. So then the healthcare workforce challenges also, like availability of healthcare paramedical trained peoples, and training and capacity building through medical systems channelizing from urban to rural area. So almost everywhere that is a problem of also providing. Maybe it is not that problem in a developed country, but country like India, we have having rural populations, we have a very difficulties in managing all this. Then emergency preparedness and response, any pandemic, how to respond that. And with that also our disaster management at the district level, they are also taking care of all this, like during COVID-19 we have seen that, like all the district level disaster management rapid action people, they have already help how this vaccination will be spread to the village level. Then supply chain disruption also, because sometimes because of the disease also supply chain disruptions, and that is also create problems to delivery systems. Then policy and governance, which is very important, because what type of policy you are implementing and how the government is, whether it is a stable government, that matters also a lot of time to take appropriate decisions. Then integrated health and environmental policies, and sometimes we have to integrate all these environmental and health policies. Then regulatory challenge and cultural and social factors, like you have some regulatory challenges, and also like cultural and social behavior. Okay. So that also helps sometimes, like to what are the social determinants, like factors of, for example, cultural, caste and religions, that also have some impact on these risk factors. Then we have social inequality. Within the social inequality and environmental exposures, like those who are not equal at the level of income, and also we have different types of education systems and they have problems. So that creates another problem to have, like how the marginalized community will be access to the resource in medical systems. So when that is lacking on that, then we have a serious problem to spreading or controlling the risk factor in the health and well-being. So then urbanizations and lifestyle changes and dietary shifts, for example, dietary shifts, different types of shifts you are taking, like what type of diets you are taking, and the loss of community support systems, because in urban area most of the times if you have not a community support base, it is very difficult to have your own regulations. So gender rules and health impacts also, what are the rule of gender, like men, women, when some healthcare systems are available for the male, or male maybe they can migrate, they can go and they can advance movement, but sometimes the women are not that easy to movement for the to access the healthcare systems. So different types of exposures we have in different level, and also access to like healthcare, which is always a very serious impact on the like different types of age groups. Then we have in India also traditional practices like Ayurveda, Unani, Ayush, we have ministry there. So we have like environmental impact, how to see, and traditional agriculture methods we are using, and biomass fuel uses, the impact of globalizations, and all these factors are also sometimes increase, and it depends like where if factors are increasing and decreasing, and that has also influenced the risk factors, like increasing pollution from industrializations. Because of that, almost all urban areas we have cardiovascular and respiratory disease. Then air and water pollutions. Okay. So air and water pollutions, asthma, people are suffering asthma. Okay. And also people are dying because of air pollutions, and water pollution, typhoids and many jaundice, that type of disease are there because of water pollution and contamination. Okay. Then transboundary pollutions, some transboundary pollutions from different industrial area, or for example best example is like stubble burning, and that creates pollution problem in Delhi. So it is a transboundary issue. So then urbanization and infrastructure stress. Okay. And then overcrowded cities, almost we have 53 million plus cities, and Delhi, Mumbai, Calcutta and all these are very overcrowded already. In a carrying capacity area the people are more. So in that case also that is create a burden or risk factor, enhance the risk factor to have medical facilities to all the people. Then waste management challenges, and we do not have a proper recycling technology, implication of recycling technology to manage the waste, and waste should be managed from the source, not from the end point. And if you just put the waste and creates like big it creates also very serious problems. Then dietary change and lifestyle disease, depression, hypertension, these are lifestyle disease. Okay. So to minimize that you need to change your lifestyle. When you are sleeping, when you are eating breakfast, and when you are in the workplace, what are you doing, that needs to be taken care of. Then westernization of diet, like all this westernization of diet means you like whatever your traditional diet system you changed because of westernization. So reduced physical activities also, because of urban area mostly you do not have or office going people, that they are not doing many physical activities, even not ready to walk, that type of so less physical activities, that also increases the risk factors like different types of disease. Then we have telemedicine and health informations, and also nowadays that has a very good area where even if you are not visiting a PHC or healthcare centers, you can get some medicine advice from using telemedicines. Then economic disparities and health inequalities, and we have healthcare accessibility, then occupational health risk. These all are also factors that influence or having increasing the risk factors of various types of disease. Okay. So for that let us see, we have how to risk factors also environmental, like environmental degradations. If your environment you are degrading, then there is a problem also for this. Then resource exploitations, climate change, and we have also global food supply chains like agricultural practices. The way agriculture practices is happening nowadays, it also change, like cultural shifts and mental health. And we have also cultural homogenization, like social isolations and spread of infectious disease, and we have like vector-borne disease, for example, like occupational hazards because of that also, like industrial workplace, and or also another very important thing is like resource depletion. So over exploitations, how the resources are depleted? Depletion of resource is basically the over exploitation of resources. For example, in a urban area, in a small area, you have density of population highest, although because of high density you are extracting water, and so the groundwater table is going down and down. So then energy consumptions also, like because of in a small area density of population high, so energy demand is very high. Impact of changing risk factors in India, like economic burden, for example. What are the economic burdens because of these changing factors? Then rising expense like for healthcare systems, and GDP growth is impacted by the loss of productivity and worker efficiency brought on by illness and incapacity, and also excess out of pocket costs associated with the medical care. Like we have medical insurance nowadays also coming, okay, which are drive many people into the poverty. So then healthcare systems in strain, like healthcare systems, overburden of public healthcare facilities leading to like decreased quality of care. So and another very important thing is like increased demand for healthcare professionals and infrastructure necessitating higher government and private sector investment. So India being a very huge country, almost 140 crores populations, we need that infrastructure strengthening. So health inequalities are made worse by rural communities, like inadequate access to healthcare in the rural area, that also increases the risk factors. Political implications, for example, some government is implementing at the central level, state governments are not implementing that programs. Okay, in that case also the state government are suffering some problems, though they have their own also policies, but still political implications are there. Health concerns are starting to take center stage in political campaigns and also policy decisions. Okay, Then public dissatisfactions with the government handling of healthcare crisis can lead to political instability and changes in the leadership. So educations of how to educate, implement, for example, the national health programs. Okay, education of that national health programs is very important, and strategies to deal with newly discovered and rediscovered illnesses. So social disparities increase health disparities with the burden of disease falling more heavily on marginalized and economically disadvantaged populations. Then gender difference in health outcomes and access, with women frequently encountering more obstacles of receiving care. Rural women, they are also one problem. Stigma and prejudice related to specific illness, which have also impact on the social integration and medical health. Particularly the stigma or prejudice are there on the gender bias, like women, they are suffering. Organizations involved, government of India like non-government organizations, and there are many such like ministries of health and family welfare, and also we have public health foundations of India and New Delhi, and like Indian Council of Medical Research, New Delhi, National Center for Disease Control in New Delhi, and also National Health Missions, New Delhi, and these are the government ministry level they are working, and National Institute for Medical Health and Neuroscience, and we have that also in Karnataka, Delhi, and we have one social NGO, which we can say Society for Nutrition Education and Health Actions, and then we have a Path India in New Delhi, and also there are another Smile Foundations. So there are many such NGOs, and at the national level they are working. So we have now go for the case studies. Let's case study air pollution in Delhi. What is the concern of air pollution? Delhi is so hugely, you can say pollution is so high in Delhi that it has created many diseases like cardiovascular, and then respiratory disease, and always air pollution is the extreme, and it is one of the most polluted city in the world. So we have during winter also it is very difficult. Sometimes school has been closed because of this severe air pollutions. So what are the health impacts because of this? Excessive levels of particulate matter and PM 2.5 and PM 10 have an adverse effect on susceptibility groups, including children and elderly, by causing respiratory and cardiovascular disease. And like various government programs by regulating car uses and industrial emissions, among other things, also graded response action plan, and other initiatives attempt to lower pollution levels in the Delhi. And within that, when you have the technological solutions like to technological interventions to reduce the pollution, or the deployment of the air quality monitoring systems, and also marketing the electric cars. Now electric cars are running in Delhi also, though people are not that much aware to increase, they should use more and more electric cars, but still it has already started. Then public awareness like initiative to educate the people about the negative effects of air pollution on health, and to promote the lifestyle modifications such as taking public transportation systems instead, like metro. Already per day 72 lakhs people are migrating, almost 50 to 70 lakhs people daily migrating through metro. That should be increased. So that will also give reduce the pollution level. Then we have another things like climate change contributions, for example. So climate change contributions also it's also huge, as temperature rise and also weather patterns shift, that air pollution intensifies and has an serious impact on the public health. Okay, so the most of the pollutions in Delhi are from vehicular pollution, dust, constructional activities, and also stubble burning. Then economic cost, like the cost of illness and lost productivity, are directly linked to the air pollution. And community engagement, like using participatory methods and education to involve local communities in the initiatives to reduce pollutions. Okay, so then we have another developing green infrastructure and sustainable urban developments, for example, to reduce the pollutions. Then another case study we have like water scarcity in Maharashtra. For example, the Maharashtra, like particularly the Marathwada region, faces acute water scarcity due to the erratic rainfall and over extractions of the groundwater, like because of its very dry area. So like health impacts, for example, here because of water scarcity leads to inadequate access to the clean drinking water systems, causing waterborne disease in Maharashtra, Marathwada. So impacting the sanitations, agriculture stress, farmers faces crop failures, and sometimes farmers are suiciding, leading to the food insecurity and economic distress, impacting mental health and well-being. So government initiatives like implementation of watershed management programs and promotions of drought resistant crops for the farmers, that are also need of the hour. Then technological solutions like use of drip irrigations and rainwater harvesting to conserve water and improve agricultural productivity. So then we have like policy challenges like ensuring equitable water distributions and addressing over extraction of like groundwater through effective regulations. Okay. Then another factor is like climate change contributions. Increased frequency of droughts due to climate change exaggerates the water scarcity in the Marathwada. That is the main issue also because of that. Then how it is cost the economy, like water scarcity lead to economic losses in the agriculture, affecting the livelihoods of the rural populations that in the Marathwada, and also community engagement involving local communities in water conservation is the best way to promote like the traditional water management practices in that area. So in the long term strategy need like developing sustainable water management policies and investing in infrastructure to ensure water scarcity. Another case study like flooding in Assam. Seriously, always there is a flood in Assam because of Brahmaputra always flooded because of rainwater accumulations on all this. So another serious problem there in the Assam because of flooding, and we are having some waterborne illness, injuries and relocations of like brought on the flooding, and have an adverse effect on both physical and mental health. Okay. So that agricultural losses like because of flood seriously harm the cattle and crops and resulting in the food shortage and financial losses. So government initiatives like putting early warning systems and also embankments into the place as a means of controlling flooding. Then technological solutions like for predictions and of early management of floods, we need technology like satellite based imagery, and also we can have like remote sensing implications where we can have early, if you can predict the flood early. Then also policy challenges like ensuring efficient disaster response and rehabilitations for impacted people, present policy challenges, and so for example another serious problem like case study how this influence the like people apart from this flood in Assam, which has a serious implications, health implications in different sectors of economy in Assam. There is another also, we have the another case study on like from India itself we can have is that like for example when we are talking about different types of case studies, there you can have detail like for example heat waves, another case study heat waves in Rajasthan, very serious heat waves nowadays, and heat waves people are dying because of increasing temperature, and temperature is almost in Delhi also this summer we have the temperature above 50, and places like Odisha, western Punjab to Rajasthan and also some parts of Karnataka we have very serious heat strokes and heat problems, that because of that heats that people are suffering, and also people cannot work properly, elderly are very affected because of the increasing heat. So because of that also agriculture stress, economy loss, and also different types of disease, we have vector-borne and waterborne disease that also creates. So heat stress is also another factor, or heat stress is a case study for this also, the increasing the risk factors in India. Okay. So finally we have some concluding remarks like you have to from this lecture whatever you have learned and we have also provided some case studies, and after that we have some book references from the website. And finally, thank you all for listening this lecture. I think from this lecture you will learn something how the changing risk factors for the health and well-being. Thank you.